Hi, so we'll speak a little bit about sleep disorders, and right off the bat, I want to get into like a few things that we're going to speak, especially in this 5 minute video. First, I really wanted to get into something called as obstructive sleep apnea. Second, I wanted to get into obesity hypoventilation disorder. Right, we've got obesity hyperventilation syndrome, and third is let's talk a little bit about central apnea as well, just to like have a differentiating factor between all of them: obstructive sleep apnea, obesity hyperventilation syndrome, and central apnea. So let's first begin with obstructive sleep apnea. Obstructive sleep apnea is what it could just be because of some obstruction anywhere in the lungs or in the tract, in probably even in the pharynx, hyper, maybe chronic hypertrophic tonsils, maybe an enlarged uvula, maybe submucosal fibrosis, any kind of thing, any adenoid hypertrophy can lead to obstructive sleep apnea. When we are talking about higher levels, lower levels probably COPD, probably narrowing of the bronchi, obstruction of the bronchi can cause obstructive sleep apnea, but that does not really matter. There are a lot of causes of obstructive sleep apnea, but how do you diagnose or how do you make sure that this falls in the criteria? Well, at obstructive sleep apnea, you have a criteria, right? You have a criteria which is sleep criteria. You check it on sleep, right? So what you check is if there's at least 5 episodes, at least 5 episodes per hour of sleep. Okay, this is one. Second, if there's a 3% drop of your SpO2, right? Let's keep SpO2. Okay. If there is a brain cortical arousal, that means let's say you're sleeping and you have an obstructive sleep apneic episode, so you wake up because of the sleep apnea, so you've already diagnosed it, obstructive sleep apnea. And each of these episodes should last for at least 10 seconds, right? They should last for at least 10 seconds, should be the lasting duration, right? So that's obstructive sleep apnea for us. So then if that is obstructive sleep apnea, obesity hypoventilation, or also now we can also combine it with something called as a Pickwickian syndrome with very high yield. It's given in the FA, is when your BMI is greater than 30, your PCO2 is greater than 45, and you have an obstructive sleep apnea diagnosed. For that, we needed the criteria. So that's your obstructive hyperventilation or obesity hyperventilation syndrome. And then we have central apnea. Central apnea is because your PCO2 centers in the brain, right, is hyperstimulated. So basically, any increase in PCO2 stimulates the brain to undergo hyperventilation, right? So you hyperventilate, and when you hyperventilate, your PCO2 drops, right? You have a decreased PCO2, and because of that, you'll have an episode of apnea. And in that process, your central apnea usually leads to something called as a chain stop breathing. All right, chain stop breathing. And that is about it for sleep disorders. Thank you very much.